Module 4, Part 2, Clinical Telehealth Virtual Consultation. Brought to you by IMU and Onsana Health. This session is delivered by Dr. Alan Tae Ki Heen from Subang Jaya Medical Center. By the end of this session, you will be able to choose the suitable platform for your telehealth practice, overcome some common challenges using telehealth, use appropriate communication technique, verbal versus text, take informed consent for telehealth, document medical notes for telehealth consultation.
Giving some practical tips rather than the whole lecture on telemedicine. And this series of 11 slides, just to let you know, was generated by ChatGPT in a single prompt. So if there's time, I'll share with you how to use AI to generate slides with a single prompt. Okay. So I didn't decide what to put up, but actually ChatGPT asked me to put these all up. So get the basics right. I think Prof. Werner has covered all the basics, but the key question you have to ask yourself, I think, is what platform are you going to use for telemedicine? Because it's something you have to be comfortable with as well as for patient. And I think you need to decide, you may not have to be like me because I use about 4 platforms. One is actually I use the hospital-based one because they already set it up, and it comes with e-prescription or medication delivery, as well as documentation and even charging. So for those of you who are fortunate enough to work in a hospital where there's already a telemedicine platform, you could use that. But before my hospital had the service, I was using DoxyMe for quite a number of years now. The reason I picked it initially was it was web-based, so it's very easy to use. All you need is a browser, and it works on your phone, it works on the iPad, it works on the laptop. It does not need any installation of software, it does not need any sign-up. And the basic one is even free. So you can use DoxyMe for free, and you can go to doxy.me, sign up, and it looks professional because it's designed for doctors. Then if you like it, you can actually subscribe to the professional version, which I do, because it gives you additional features like multi-user participation. So even you can do group counseling with your patient's family from around the world. And it also allows you to upload and download files, particularly useful for lab reports, and also allows things like screen share and even sketching. So these things may substitute an inpatient visit because you can actually illustrate and share things just like you would in the physical visit. So you choose your platform. I mean, Zoom is fine. It's even the basic version is free at 40 minutes, so you don't have to pay for Zoom. Only thing it's general. If you're in the US, of course, you can't unless you use the HIPAA compliant version of Zoom, which requires a subscription. But the free, we are fortunate in Malaysia, we don't have HIPAA requirements. So I think Zoom or Google Meet to me is fine. And as long as you're using a video teleconsultation platform, to me, the compliance is there because of the patient identification point, which is face-to-face. So for follow-up patients, you actually identify the patient who you see. And this is actually, something which I emphasize to patients. And I use this thing. I don't do phone consultations. I don't use WhatsApp consultations simply because we can't really identify who it is at the other end of the line. And I think this is very, very important, the patient identification aspect. So I prefer face-to-face using DoxyMe. You could use Zoom or Google Meet or any of the other video platforms because it is a virtual face-to-face meeting. But nevertheless, you should go over with the patient on how to interact over the video and not although it may be easy, if it's particularly web-based, they don't have to install any app and so on, but it's still something, there's a small technology hurdle for them to overcome. The other hurdle is, of course, they need to be at a place where they have adequate internet connection. So not everybody may have very fast internet, though most people with 4G, 5G phone can actually access the basic internet connection platform. But nevertheless, sometimes what I do in the clinic is I go through with them. It takes a bit of time, but it's time well spent because you can demo the connection to your patient when he or she is there with you in the clinic. All right, so they know how to access it.
Sorry, Dr. Allen, can you put into presentation the slides?
Sorry?
Your presentation view.
Yeah, I thought I did.
PowerPoint, yeah, but it slipped back.
Yeah, thanks. I don't know why it's, let me see, yeah. I click on the present mode, it's not working.
I see. Okay, never mind then.
I'm clicking resume slideshow, it's not working. Yeah.
Never mind. Yeah.
But doesn't matter, it's not
too small, yeah.
Yeah, it's a bit small, yeah. But doesn't matter. I don't know why it's not.
It's okay for notebook, it's okay. Just people using handphone, I'm not sure. It's okay, they can zoom. Thank you.
Yeah. Let me try again.
But Dr. Allen,
yes,
you're talking about these patients connect. Can I ask the questions on like, is it common that the patient's connection problem, and then so how any other kind of challenges besides patient connection problem?
Well, you choose a platform which is easy to use, no sign up required because you're using a face-to-face identification thing. The challenge is less. I use another service called TeleMe. Some of you may have heard of it, teleme.co. It is a telemedicine service run by my friend, Dr. Ho Honbing, who is an ophthalmologist. It is app-based or web-based, and there is a chat service. So it's text-based mainly, but the identification is on a sign-up. So the patient actually has to sign up and register with the service. So you can identify by patients who have signed up and favorited you as their doctor. And this kind of text-based telemedicine service is more compliant than WhatsApp because of the default sign-up process, and also they have to agree to a consent form which is built into the platform. Doxime also has a built-in consent form which you can customize as well. So when the patient gets onto Doxime, they will see that there's a consent form before they start the telemedicine session. So the good point about TeleMe and text-based platforms is they are low bandwidth, so you do not need very good internet access, and also it is not doesn't have to be real time. You don't have to be there or at the time where the patient puts his or her question. So that's some advantage of compliant text-based platforms. So when they say, oh, my internet is no good and I'm not sure I can do all this video conferencing, then you can suggest a text-based platform for such patients. You got to see what other features like TeleMe also has features which includes e-prescribing, ordering labs with partner laboratories like PathLab, and they do also have a video consultation component, so you can convert it to a face-to-face video if you want to. So it's fairly okay, but recently I had a patient like that who's going back, she just needs to have an INR check and she stays in somewhere in Perak and there's no nearby hospital. She has to drive about half 20 minutes or 30 minutes to get to a hospital for INR, but she has access to a lab. So I had to get her to sign up with TeleMe, and I found that actually, if you go through the process with patients, sometimes it's quite challenging, to enter email and say, oh, I never use email. You have to learn how to log into the email, retrieve how to set up passwords and so on. So it's best whatever system you use is go through with the patient at the time they're with you in the clinic. So there will be less hiccups when it comes to the usage of telemedicine. So I think that's time well spent, because and you'll be surprised how much of a hurdle it might be for some patients when it comes to new technology. I don't know whether this was covered, but make sure you're dressed professionally.
Grade 6.
Yeah. Sometimes you are doing telemedicine from home, sometimes you forget, oh, I'm dressed in my t-shirt or something. So I don't think you need to put on a tie or something, but they actually look like a doctor, I think, when you do so. And sometimes you got to be mindful you're doing it from home. You don't have like little children or kids running in the background or whatever. So I said, if you have a study or something, you can lock yourself with it and make sure there's no ambient noises and all that, which can actually disturb the telemedicine session. Sorry, I hope you can see. Backup plan for technical difficulties. I've had this happen to me on a few occasions only. And I was using DoxyMe, I could see the patient, but for some reason, I could not hear her. For maybe she didn't set up the microphone properly, and but I could identify it was her. So in the end, we resorted to half and half. So it was a video consultation using DoxyMe. I could see her, but I actually rang her on the phone. So I called her on the phone and I was talking to her. So the audio component was on the phone call, but I could see that she was talking to me. So in cases like that, sometimes switching to old technology, but this is not doing telemedicine using just purely a phone. It's still a face-to-face consult. But you could do that and I had to do that on a couple of occasions, but it's not common. But that would be one backup plan. The other thing is you can always reschedule it when to a better time, when there is a better connection and so on, especially if it is not so critical or time dependent kind of consultation. Sometimes I've had to reschedule on my end too because I've had medical emergencies, and I actually have to apologize to the patient. We just need to reschedule it again. Scheduling is very important because you have to allocate your time as well, not just the patient's time. I don't think it's advisable for anyone who wants to embark on telemedicine to be available 24 hours. And I tell my patients it's not physically possible for me to provide a 24-hour service. I need to sleep, I need to eat, I need to do all the normal bodily functions as well. I cannot be available 24 hours. So hence I have and I think you should try to get some what do you call scheduling or booking system, and some of them come with booking service fee. You can put it in, and that will be your telemedicine charges. You can put it at the same time. There are many platforms available. We can share. We can talk about it later in the Q&A. Boundaries and guidelines. ChatGPT asked me to talk about boundaries and guidelines. I think the most important boundary would be actually, what can we talk about? And I think we talk about it is not an emergency situation, which is already in the consent form, but sometimes patients don't read or don't understand. So we really establish that the session is really not meant for that. And I think we have to also really set a time frame. Sometimes it can get to go on and on. You have to say right from the beginning, this is 15-minute telemedicine session. I think they have to be clear about what you're setting. And then your consent also sets the guidelines for what we can and cannot do during the telemedicine. We cannot, other than visual inspection, and we can't physically examine them the other way, though it's quite intrigued to hear there will be sessions on how we can use remote scopes and devices and all that for teleconsultation. But there are more, I guess that will be covered in another module. Okay. clear and concise language to ensure that the patients understand the information we conveyed. And I find this can be challenging sometimes when there is medical terminology, and some of these can be quite complex, or using drug names, and you don't want the patient to misunderstand you. So if your system, I think most of them would have a text chat window. So Doximity has a text chat, so does Zoom, and so does Google Meet. So I don't never hesitate to type it out. So if it is a medical term or a drug name or even a drug dosage, you can tell, but at the same time in the text window say, I'm going to spell out the name of the medicine, and this is what so and so. So it's very clear to the patient. So don't just rely on speaking. So illustrate it as well. Sometimes if you have a available sketch utility which you can share with the patient. So I'm not sure if Zoom has it, but I think Zoom might have. But I think Doximity, if you have a paid version, will have a sketch pad as well, where you can actually illustrate things in case that words cannot convey the same information just as well. Okay, and that's it. Yeah, so it's screen sharing or virtual whiteboards. The same way you can convey that experience to share with the patient. Encourage patients to engage in conversation and ask questions to facilitate a more in-depth and meaningful telemedicine session. I think a lot of them. Okay, ChatGPT, what do you want me to say? I think, a lot of our Malaysian patients sometimes are a bit shy when you're using new technology. So you ask them, you got any more questions? I always end, even in a real physical visit, be it a ward round, clinic visit, it's always good to end with, is there anything else you want to ask, or what other questions do you have? You give them an opportunity to open up. And I find our Malaysian patients are a little bit maybe reserved, and when it comes to that, they're tongue tied, and then they don't know what else to ask you. In fact, I think telemedicine is good because when they see you in the clinic, sometimes they're overwhelmed with so much information, and then you can tell them, an opportunity for you to go and ask questions again as a follow-up in a telemedicine consult. Beforehand, maybe you want to write down the questions and the things you want to clarify with me, and then we schedule a telemedicine visit. So I think that's one very useful thing, and you can encourage usage of this thing by facilitate that part where there are very often unanswered questions in the initial physical visit. So what I do, and sometimes I do this FOC, I tell the patients, look, you will need this. Okay, you're going back to Indonesia after your bone marrow transplant, and you will need to stay in touch. So actually, sometimes I will schedule a complimentary telemedicine visit with them. Okay, having gone through what it is with them, I say, okay, I need to see you on such and such a date and time, and we will use this platform, and we'll get in touch. And beforehand, can you get a blood test ready? I want you to have this full blood count or whatever it may be. Then, so that's that. What is the important continuity of care? So you take the opportunity, you identified your patient, and you want them to be able to keep in touch with you, and for their reassurance, for your reassurance as well, you can just initiate that. Don't wait for them to schedule it with you, but you can actually initiate the first visit. You may not want to, whether you want to charge or whatever, it's up to you, but I think it's important that the initial visit, if it is initiated by you for the appropriate patient, it can be very useful, and it could be the beginning of a very long relationship between doctor and patient, which can be mixed, virtual and real visits, and they are comfortable as long as they're comfortable with it. Okay. Okay, legal and ethical considerations. We are, as I think Prof. Lena mentioned, the legislation, the regulation is very much behind time. Recently, we had a visit by one of the MOH senior people to talk to us about fees. They came to the hospital to talk about fees. And then he mentioned, by the way, you cannot charge anything for telemedicine. Blah, blah, blah. I said, I didn't want to upset, and then I just kept quiet. But just because the fee schedule does not mention any telemedicine charges does not mean I think you cannot charge anything. I think this is something which I think the Ministry of Health needs to move out of the 20th century into the 21st century. And I think we need to know how to better regulate the space, but there obviously needs to be some rules. Otherwise, like all things, they can be abused. But at the same time, they can't be expecting our practitioners who are trying to provide an extended service to our patients without appropriate remuneration. And I think anyway, by de facto, they have come out with the guidelines during the COVID pandemic. So MOH cannot say we don't recognize telemedicine, even though they say, oh, the Telemedicine Act of 1997 has never been enforced. I'm aware of a draft of new telemedicine guidelines which were put up, and I think there was some protest because they clearly stated you cannot use platforms such as telephone, WhatsApp, and so on, in those updated draft guidelines. But I think there was some protest. I mean, you can't say you can't use phone at all, because sometimes we do use phone. Depends on how you use the phone. If the patient phones in, it's difficult because you're not sure who's calling you. But sometimes we do call the patient. And then you identify, is this Mr. So-and-so? I need to advise you to come to the hospital quickly because your blood results or something like that. The phone, although it's old school, sometimes we still use it, but you have to use it in the appropriate manner. We can talk about it in the Q&A, but I think this is something which is not quite under our control. It's really up to the authorities. Okay, I think those are the 10 tips which ChatGPT asked me to tell you on telemedicine. I have maybe some other anecdotes and so on, but I'll be keen to hear what you all have to say in the Q&A.